All right, back pain, you know, it's a common issue for a lot of people, and we're on your side today with our Ask the Doctor segment. Joining us to talk about this is Dr. Jay Fitz, who is an orthopedic surgeon at UAB Medical West. In studio, how are you doing?
I am doing great.
Okay, so I think there's a different levels of back pain, you know, where it could be a little sore or stiffness, but we're talking really deep pain that you know something could be a major concern, am I right?
Absolutely. It's more so what we're getting at today is back pain that's debilitating and really stopping people from doing their daily activities. That's more so what we're getting at. Not just the occasional ache, but the one that's really causing you to change how you function throughout the day.
Well, then what causes some of this this debilitating back pain?
Yeah, it can be a number of different causes, but some of the common things are like a muscle strain, or poor posture, or sometimes underlying conditions such as arthritis or herniated disc.
Yeah, I've noticed sometimes I'll do a certain movement and I'll feel a little twitch in there, and it's almost like the breath gets knocked out of me for just a short period of time, but then I'm fine, so I never worry about it. But these type things can happen in an instant, can they not?
Absolutely, and a lot of times that's exactly what happens. It start off with something small. You know, you might be lifting something up and just happen to feel, like you say, that twinge, and it can kind of stir up some things and have you in pain for some time.
Yeah, and if it's happening longer than just a minute or so, and it's lasting a little longer, what should you do if you're experiencing this?
Yeah, so first thing, I think you should make sure not to ignore it. I think a lot of people try to just tough it out, you know, but I think especially persistent pain can be a sign of something more serious. So we usually recommend simple treatments like over-the-counter anti-inflammatories, gentle stretching, being more cognizant of your posture. But if this pain is lasting more than a few weeks, or if it's associated with weakness, numbness, or pain down the legs, then you probably should come and see a specialist.
So when we get to that point and it's chronic back pain, what are some of the options there?
Yeah, so there's many options for chronic back pain. We usually tend to start off conservatively, so physical therapy, medications, and for some cases we can do injection therapy to kind of reduce inflammation. And then when that is not enough, there are some more advanced options like minimally invasive spine surgery that may be recommended for some people. Yeah,
and those things are very serious indeed when you get to that point.
Absolutely. You know, the overall goal is to try to get the patients pain relieved and them back to their normal activities as quickly and safely as possible.
There you go, Dr. Jay Fitz right there. Excellent job right there. Orthopedic surgeon at UAB Medical West. Appreciate your time today. And you just see some of that right there. Just be careful whenever you're doing something, and if you start to feel something, don't let it slide, right?
Yes, sir.
Absolutely. Thanks so much for your time.
Thank you.
And we